Good afternoon, Santa Clarita. This is Tom Burton, bringing you the Providence Holy Cross Health Hour. We've been gone for a little bit of time. We're back now and back strong. Extremely excited today. We've got a very, very interesting guest to go into what's upcoming to Holy Cross in the very near future. Some people may ask, how come Holy Cross, we're the Santa Clarita Valley? Holy Cross has been around for well over 50 years and has been servicing the San Fernando Valley as well as Santa Clarita Valley for a very long time, including most traumas. They've been coming into Holy Cross as well. Estimated right now, about 15 to 20% of all of our patients that come to Holy Cross are actually from the Santa Clarita Valley, and 15 to 20% of our employees also live in the Santa Clarita Valley, and that's only going to grow, in part because our partners with Providence Health System is FACI, and FACI has a very large footprint here in Santa Clarita, and we're just very, very excited about what's coming up into the future, not only at Holy Cross Medical Center, but how Holy Cross is going to be expanding into the Santa Clarita Valley. Just a little bit about Providence as well as far as a health system. They own Holy Cross. Providence is throughout a number of different states. They've got at least 34 hospitals, 600 clinics, and is the third largest not-for-profit health system in the nation. Providence has been integral in allowing Holy Cross and all of its other ministries to be able to utilize data, improve how our best practices are. It has been great. It's been wonderfully influential. And when you have leadership and innovators that allow us to be as successful as Holy Cross has had the opportunity to be, it allows us the opportunity to reach out to our industry to try to improve that as well. And that brings us to today. Holy Cross offering a number of different aspects to surgical approach, a variety of different ways through urological, gynecological, orthopedics, general surgery. We are utilizing minimally invasive anytime we have the opportunity to do so, and we are offering robotic surgery, which seems to be the wave of the future and is upcoming. But we do have a void, and that occurs within our general surgery. And because of that void, Holy Cross recognizes that not only just in the present, but now coming up into the future, that we need to do our part to assure that we have the right people backing our programs. And I have to say, a special thanks before we even get started with that to KHTS, who is a huge backer to Providence Holy Cross Medical Center. It's having the ability for the community to sit behind us and to allow us to grow has been just an unbelievable help, reaching out to the Santa Clarita Valley as well as working on the board within Holy Cross itself, and allows us to move into a direction that is only going to be helpful for the future of our patients, future of our community, and the future of medicine as well. And because of that, let me just introduce, we're with us today. We have a very full area here. Hopefully you'll be able to see this on the podcast and on the video on YouTube. In the case that you're traveling, I was told that there's an app, so we want to make sure that you download that free KHTS app. You can get it for your iPhone or your Android. You can listen to KHTS wherever you're at, worldwide, so that way you don't miss any of the shows. Even if you happen to be moving out of the Santa Clarita Valley, you'll still be able to keep up with all that's going on. So I just downloaded the app myself. It took approximately 25 seconds, and I'm an adult, and you know how that is with technology. Very, very easy. So definitely go get the app. This way you're going to be able to listen to what all's going on throughout for KHTS and keeping up to date as far as the Santa Clarita Valley. So I'd like to introduce Dr. Daniel Marcus, and let me just start one. He's a UCLA grad, and that makes me just smile and tingle inside. Welcome, Dr. Marcus.
Thank you.
He is a Bruin, received his medical degree from the Sackler School in Tel Aviv, Israel, surgical residencies at the world-renowned Albert Einstein Montefiore Medical Center and Columbia Presbyterian in New York, surgical fellowships at another Pac-12 school, and go Pac-12, University of Oregon, and now a general surgeon specializing in minimally invasive procedures, specifically robotic surgeries. And besides being a physician in his free time, he's an educator as well as an author. And let me tell you, the CV could go on and on and on, but let's just go ahead and get right to it. Dr. Marcus, thank you for joining us.
Thank you, Tom. And thank you, everyone, for listening. I think this is a great welcome opportunity to talk a little bit about what's happening in surgery, and specifically in the field of minimally invasive surgery. I've been involved in this field for 20 years, finishing my fellowship in 1995 already, feeling old, but still young. And the last several years, the last 10 years, we've been in a growth in an even more high-tech part of laparoscopic surgery, which is robotic surgery. A robot is not something that does the surgery itself, but it facilitates and helps us do laparoscopic surgery. Many years ago, the robot was first developed at MIT, initially for military purposes, thinking that you could do remote surgery from afar. And although that is still possible, really the lion's share of what we use robots for is all fields of general and other specialties in surgery. The most common in the United States is prostate surgery. Now 95% of gentlemen who have prostate surgery are having it performed with the aid of a Da Vinci robot. That's not the case in a lot of places in the world, but in the United States, that is for sure a very common practice. In the last several years, general surgery, specifically colon surgery and hernia surgery, has also become very much a mainstay, as well as gynecologic surgery and thoracic or chest surgery. I was an early adopter, as many things. I like to get involved sort of on the early end. And 5-6 years ago, I started getting involved in doing robotic hernia surgery and robotic general surgery, colon surgery. At the time, people thought it was crazy. There were even many people who thought it was heresy to use a robot to do this kind of thing. But now, fast forward 6 years, many of the people who were naysayers are actually jumping on board. And I think the reason is because the results are good. Not only are the results good, but I think in many cases we can see that the results are superior. Of course, even back in medical school, the first thing we learn is first do no harm. That's what we finish medical school with. That's the oath that we take. And I think robotics has the ability to help us be as safe as possible. At the same time, I think it offers a lot of advantages. Specifically, a robot enables us to have HD, 3D visualization, so we can see things much better than even the best laparoscopes that are involved right now, or the cameras that are used. Most people know that if they know anyone or themselves have had gallbladder surgery, in the last 20 years, that's been done laparoscopically with a small camera and 4 incisions. Robotics enables us to do that same operation through only a single incision, basically hiding all of the scars through just a single incision in the belly button. And not only cosmetically, but there's a lot of other advantages to that.
Can you go into those advantages? I can imagine that obviously the outcomes, the ability to return back to activities sounds like it probably could be a little quicker than with other ways of doing that procedure. But can you kind of step us through that?
Sure. So the one thing that I would say that robot really facilitates or enables us to do is to use our wrists. Now, if you think about it, if you fell off your skateboard or snowboard and you had casts on both of your wrists, you'd be able to eat, but everything would be a little bit more challenging. And I'd say that is what laparoscopic surgery has been. We've learned how to accommodate, but the robot now enables us to use our wrists again. So all of the instruments have what we call endo-wrist technology. And that really changes the field completely. Now, for gallbladder surgery and single site, we're able to make a single incision, and then through a special, very ingenious design, all of the instruments go through the belly button, through a single channel. The robot enables us to see things expertly, and we're able to see, even with immunofluorescence, we can see the bile duct, which is the one area where there's potential damage. We can see that with immunofluorescence perfectly. Now, actually with us today also is a patient of mine, Mr. Bruce Stone, and I thought it would be an opportunity to have Bruce talk about his experience because Bruce had significant pain from gallbladder. He came to see me, and we talked about the possibilities of laparoscopic versus robotic surgery through a single incision.
Perfect. Mr. Stone, please, let's hear your experience. This is great.
Thank you for having me. I was actually very thrilled with the outcome from the robotic surgery. I went to see Dr. Marcus, and I was having pretty significant pain, and I was kind of concerned. My son's wedding was coming up the following weekend, and he talked to me about the different options, and I was very concerned. I didn't want to have the surgery. As I said, it was my son's wedding. I wanted to be able to dance. We had relatives coming from out of town. There was just no way to cancel it. And he assured me if I went ahead with the robotic surgery, I would at least be up and around for the wedding. I never expected to have much more in the way of an outcome than that. And it turned out to be remarkable. I had the surgery on a Friday evening at 8 o'clock. I went home the next day at noon. I relaxed over the weekend. I think I stayed home from work on Monday, but I went back Tuesday and I was dancing at my son's wedding, if you could believe it, the following Saturday night.
Oh, that's absolutely fantastic. Now, the question that I have is, how did you know to find Dr. Marcus? What did you do a little research prior to see what might be available? Was there a referral, or was?
I did. A matter of fact, I was at a loss to find a doctor out in the San Fernando Valley. I'm from this area, and I did some research, and he came very highly recommended. He was in Los Angeles, so I ended up traveling there. So, and in fact, I had been to Holy Cross a number of times in the past, so I'm excited that this service will be available out here.
Oh, that's fantastic. Yes, with the emphasis going towards robotics, to be able to fill the void, as you so eloquently put, we're going to be able to have that offering to our communities and not have to go, over multiple hills in order to be able to achieve the same results similar to what you went through. Now, Dr. Marcus, is this a similar result that we should anticipate?
Yes, I think, we have now performed over 500 robotic procedures and more than 150 robotic gallbladder surgeries. And I would say that Bruce's experience is very typical. Of course, there's some range. Some people require some pain medication and maybe a little bit more rest. But for the most part, if we look at, and we've just presented recently at a national meeting 2 weeks ago, if we look at our own data, we would say that for the most part, patients are doing better, having better return to work and better return to baseline activity, having a robotic approach.
Are there any precautions or anything that we needed to keep in mind? So it's in the case you're doing a single incision, are there limitations or restrictions that a patient should be following?
For the most part, there are very few restrictions, and some of that is there's no proof one way or the other, but I'd say we're very liberal with how quickly people can get back to work. I tend, just my practice, have a lot of athletes, professional athletes, have operated on people from players from the LA Kings, and I will say that's a pretty good judge that after doing this kind of surgery, people are back to, skating 4 days later. That's a pretty good indicator that you can do whatever you want. For gallbladder surgery, whether it's done open, laparoscopic, or robotic, there are some postoperative restrictions. One, we keep people on a low-fat diet for a couple of weeks just until their physiology adapts. But as far as the technical aspects, limitations from the surgery are pretty low. Usually just ibuprofen, Advil, or Motrin. There are a few people that need something a little bit stronger, but for the most part, that's all they need.
Right, and then you also mentioned too, off-air, that there are specific post-operative analgesic process that you might go through as far as specific injections and the such like that?
Yes, we can do some regional, what we call a tap block or a regional block. So for hernia surgery, which is a very big growth in robotic surgery, we can give injections that sometimes people won't need anything at all. But as far as getting back, to swimming, to normal activity, we constantly are encouraging people to get back to routine activity as quick as possible.
Oh, that's fantastic. That's one of the big calls for us right now to be able to meet at Holy Cross as well as all the other hospital systems is trying to make sure that the patient experience is a solid experience and a great experience, and part of that comes with pain management, and that's some of the medications that you were talking about, the regional blocks and the such. Not only are we doing it in general surgery, but a couple weeks ago I had the opportunity to speak with Janice Murray on her show, and we were discussing the regional blocks and the nerve catheterizations that we were able to do with some of our orthopedic procedures as well over at Holy Cross. So makes me very happy to hear that we're able to do similar activities with some of the other surgeries, having gone through abdominal surgery, open procedures myself. The discomfort of just the post-surgical site and the such, and a lot of the restrictions towards physical activity was very difficult for me, especially as a physical therapist by trade. So,
and I will say one thing that it's important. I like to use the phrase having just another arrow in our quiver. I think it's smart to have a lot of choices, whether you're a surgeon or a patient, and I think to say that either a robot or a laparoscope can answer all questions is not accurate. So the most important thing is first and foremost to know that there are options, and sometimes even myself, who loves doing robotic surgery, will decide that another approach is maybe best for the patient. So we want to do what's best for the patient, and that's, I think, first and foremost.
Well, I think that brings up a great point is patient selection. Obviously, there's going to be criteria that people will have to be able to meet to be able to move forward with more minimally invasive versus an open procedure. Can you go over some of that criteria?
Sure. So if we look at, now of course some things that are more urgent, like Bruce's gallbladder surgery, some things are urgent, some things are even emergent, where somebody will come into the emergency room. And when I was a resident, and 20 years ago, people would say, well, if you have an inflamed gallbladder, you have to be on antibiotics and we'll take care of you in 6 weeks. That's really, in this day and age, for somebody who has a lot of experience, that's never the case, or rarely the case. So we should be able to do things, and often the robot actually facilitates me doing an emergency surgery better than a standard approach. Somebody might come in with a bowel obstruction from a trapped hernia or an incarcerated hernia, and that often is facilitated even best with a robot. So patient selection in that respect, and sometimes you have to know that sometimes a patient is too high risk because of medical reasons, that we have to do a standard anterior approach. So there are many different factors to consider. One of the things that some patients might not be happy to hear is if we're doing hernia surgery, for instance, and somebody has a large abdominal wall hernia, and we know we're going to fix that hernia, be able to suture it closed and put in some mesh, we know it's well established that if you are significantly overweight, that the recurrence rate is very high. So sometimes there are factors that will lead to not as good a result. Smoking, diabetes, other connective tissue disorders, weight gain. And we will often, and it's really standard, I just came back from the American Hernia Society national meeting, and there have been studies that have been proven that if somebody is smoking, their rate of recurrence is much higher. So we will demand and that patients stop smoking, and even to the point of sometimes checking nicotine levels. And if not, this is a partnership. It's not just dictated by us, but it's a partnership between patients and the physicians. And so long as everybody adheres, we want everyone to get the best result.
Perfect. And that's the collaboration that you were discussing. We'll probably come back to that. Just for the people who are just coming on right now, we're talking with Dr. Daniel Marcus, and we're here with the Providence Holy Cross Health Hour. We can't help but think that as we continue to grow over at Holy Cross, to make sure that we're going to be able to answer the community needs, and the collaboration that Dr. Marcus was just talking about fits in beautifully with community health. And the process of community health as being such an important piece within the Providence health system, and being able to go out and create a healthier community. Not only is it going to be beneficial to the community, but obviously for the type of work that you're going to have to do, we're going to need to make sure that those patients are going to be healthier coming in. And that's going to improve the outcomes as we go forward.
Definitely.
Well, very good. Well, right now, we're going to go to a break. We are here with KHTS AM 1220, your hometown station. We'll be right back.